My name is Celia Mead. I'm Executive Director for BIRD, Bath Institute for Rheumatic Diseases. We're a small medical research institute founded as a collaboration between the hospital, the RNHRD at the Mineral Hospital, and the University of Bath back in 1975. Formally incorporated as a charity in 1981, so been going some time. I understand that BIRD started off as just 2 people working in the basements of the Mineral Hospital in some quite interesting conditions, and then BIRD grew, took over the building opposite in Trim Street, and then moving back into the Mineral Hospital site later on, and now at the RUH site at Coombe Park. But BIRD was founded as a collaboration between the university and the hospital, so that researchers and clinicians could work together on studying bone and joint disease, in rheumatology, and has some really good rich history for training PhD students, post-clinical fellows, clinical fellows and postdoctoral research students. And in fact, when we had an alumni reunion in 2018, people came from all over the world, from Australia, India, Argentina, and those were people, rheumatologists who had done some form of training with BIRD or passed through BIRD's doors in some way. And today our purpose is threefold. We fund research, about £80,000 a year's worth of pump priming research. We engage with patients, get them involved in understanding their disease, and understanding what the latest treatment might be and the research that they might wish to get involved with. And then lastly, we run education programmes for healthcare professionals. BIRD runs at least seven information sessions a year for patients, which engages them with the latest treatment, the latest understanding of what's going on in their disease area. We get them involved. We try to draw them into research as well, because it's so important that we do have patients actively involved in research. And they're involved across the work of BIRD, so we have trustees who are patients, and feeding into everything that we do, including the grants that we hand out. So the sort of projects that we like to fund are very early stage, and where we can, BIRD funding allows other funders to take part, and that might be in, for example, digital technology. So Dr. Raj Sengupta and his ankylosing spondylitis app is currently the latest stage of technology, where patients upload their information through the app, and it allows Raj to look at their results in clinic, and he can see a whole year's worth or more than that of data, rather than relying on the patient to remember what's top of mind. But it also allows him to analyse that data and to look at patterns and the relationship between variables. And we have helped Project Nightingale by funding some of those patient engagement events.